I think we are coming into an era of compressed morbidity, where we have to think about how can we make this part in life where we are old and sick very short. And that we can only manage if we increase health. And the problem is that the discussions in the health sector are very often discussions about sickness and diseases. And that's not enough. We have to link the old sector of health, of medicine, of hospitals, of pharmaceuticals, to the question, why do people want to live longer and healthier?
We know that we are in a situation where our population become older, and we need to make sure that they stay healthy and active. The European Commission has launched today a new partnership which is called Innovation Partnership for Healthy and Active Aging, because we need new form of collaboration, new form of cooperation and new efforts to face this societal challenge.
If you take social care and health care, how can you have one without the other? They've got to be there. I think Europe's got to make them a joint competence in due course, but Gastein can set a lead on that. And then we really will be making good health policy, which we can afford and which will then contribute to our better and healthier economies throughout Europe.
The key to managing complexity is through an approach which abandons the fragmentation that we've had of policies up until this point. Government does not work in silos. Policies bleed across to each other, and this defragmentation of our political, our policy, our implementation approaches is absolutely crucial for us to even grasp the level of complexity, let alone start to address it.
We have a steepness in the pace of aging ahead of us, the next 20 years, which is unheard of and which we have not experienced over the last 40 years. So the additional aging burden, if you wish so, which is not a burden but a very happy thing actually to happen, except for the health insurance and the old age pension insurance, and those schemes have to be reviewed and reframed and innovated. We have just not been able to live up to this basically wonderful challenges.
I think we need more expertise how this management of change could work on the health domain. And Gastein Forum actually could help us as this brain laboratory to find different approaches and different solutions about the how.
The essential challenge now is communication, actually, and interconnectedness, because we need to actually interconnect ourselves, first in concepts, because sometimes we have dichotomies which are not real, like public health versus individualized care, and we need to do both, the individualized perspective together with the collective perspective.
To be able to individualize care, we will have to understand a lot about genomics and the interconnectedness of the various biomechanical things that are in our body on a molecular level. Yes, it might be individualized care, but a lot of interconnectedness and a lot of network phenomena understanding will come into play.
We are living in a highly diverse healthcare sector, and we need a good interconnection between the information flows from A to B to C. And that's one of the fascinating things we have to work on.
As the president of COSTIA, I am definitely very much on the issue of interoperability, of the connectivity of all the different products. None of our products which we produce doesn't have an IP address anymore. So it can be part of a global network of service deliveries. And now we just have to make sure that this interconnectivity is also used in order to follow the patient through the continuum of care. And a meeting like this will bring all the different stakeholders together and make them familiar that the technology is there for interoperability. We just have to use it.
The challenges are obvious to all: demographics, sustainability, the shift towards personalised medicine. Within all of this, from our perspective, it's absolutely critical to continue to strive towards patient-centred, high-quality, equitable healthcare for all patients across the European Union. We need interconnectivity, as the Minister said on the first day. We need solidarity, and we also need trust.
IT is going to be able to put in the hands of every individual the means to live healthier lives and the means to live more independent lives for longer. So I think in both the university world and down on the street, IT is going to be relevant to health outcomes in Europe.
I think the future is complex. We're going to have all these different organizational mechanisms, public-private mixes that we don't understand, new technologies, information systems, new pharmaceuticals. Very complex, but I think the secret of it is going to be the extent to which we can steer all this innovation, all this information, to put finally the consumer in the driving seat.
I believe that prevention is the guarantee that we will have sustainable health in the future. It's like building up our reserves in health to cater for catastrophes that could happen to healthcare systems in the world.
The challenges is certainly the way of giving diagnosis and treatment together, I think. The way will differ from now. Innovation is one of the solutions. How can we interconnect research from the different areas? And I give one example, rare diseases. You cannot do it anymore alone. You have to cooperate with different universities. So that's also in diagnostics, I think. That's also in treatment and care.
I think the key themes here have been prevention, the need for self-management, the shift of care from hospital to community settings, and all of that requires a technology that allows people to share information and data between patients and hospitals. Hospitals should no longer be the preserve of data.
The budgets will be limited. We need to collaborate. We need to collaborate on a global level. And in my view, Gastein could really contribute to that idea. And I hope that we are able to organize this global health in a more efficient way.
All the interconnectivity that can take place in the health system can be improved if the patient is well educated about what's available, or alternatively is given assistance in the sense of perhaps a health navigator to guide them through the system, to help them make the best of all the different issues, all the different services for their needs at that particular time.
The world is getting much more complex. I've been attending the session on ageing, and there we've been seeing the interconnectedness of absolutely everything. The need to prepare for an ageing population, the need to look at the working environment, the need to look at preparing people for retirement, the need to look at the ways in which we use people who are already retired. And that involves bringing people together from a wide range of sectors, joining it all together. That's the challenge that we face.